Friday marks exactly 17 years since one of the darkest moments of the 2003 SARS outbreak in Taiwan. On April 24, 2003, the Heping branch of Taipei City Hospital was locked down, with staff and patients shut in together for days to contain a sudden outbreak of the SARS virus.
Many of the officials leading the response against COVID-19 today cut their teeth on SARS, including Dr. Chang Shan-chwen, who is a top consultant advising the Epidemic Command Center. In the briefing on Friday, he was asked to reflect on the anniversary of Heping's grueling lockdown. He expressed optimism that the situation today looks much brighter.
April 2003, and an ambulance leaves the Taipei City Hospital Heping branch with the first suspected SARS patient. But while the patient left the building, the virus did not. Within days, Heping became the first hospital in Taiwan to be quarantined in toto.
和平医院暂时关闭，全面管制。
Police tape is put up and iron gates come down. On April 24, 2003, staff and patients were locked inside Heping for days after the outbreak was discovered. At that time, Dr. Chang Shan-chwen was head of the National Taiwan University Hospital Infectious Diseases Department.
This may be a mutation of the virus, or indeed a completely new virus.
17 years later, Taiwan is dealing with a new brand of coronavirus, and Dr. Zhang now leads a specialist consultant group for the Central Epidemic Command Center. At the briefing on Friday, he was asked to reflect on that fateful day exactly 17 years ago to the day when Heping was locked up.
Yesterday, I went to Heping for the second time since the epidemic began, I think. I saw how hard they were all working to take care of their patients. This time, nobody is afraid to be near the hospital or visit shops nearby.
我相信张教授一定是感触很多，然后他将来可以写一本书哈。
I'm sure Professor Zhang feels deeply moved by remembering this. He could write a book one day. I'm serious. He's had so much experience. I remember back during SARS, I was the secretary of the Dentists Association. I just stepped down, and at the first opportunity, I went to him and asked what we dentists should do. There has always been a war between viruses and humans.
Dr. Zhang's role in that epidemic will never be forgotten by SARS patients like Dr. Chang Shan-chwen, who worked at Heping when it was locked down.
About the third time we talked, Professor Chang Shan-chwen said to me, when you were in the ICU, they were really scared several times. It looked like you were on the brink of passing on quite a few times before we brought you back.
The SARS outbreak has had a massive impact on Taiwan's attitudes to handling COVID-19. Many top health officials are motivated by vivid memories of the crisis in 2003, and none more so than Chen Shizhong, who has worked non-stop for almost 4 months now.
When there is an epidemic or any infectious disease, there's one thing everyone needs to be clear about. There is no shame in catching a disease. 17
years on, Heping's lockdown is an enduring reminder that the ordeals of today will one day be the lessons of tomorrow.